Hi everyone, this is Team PIST. Our team project is called MOK, stands for I'm OK and Medicine OK. This is a wearable device to remind the elderly with chronic diseases of taking medicine. Our team members are Tian Bao, Joanne Li, Yifan Wu, Nan Xiao, Wei Cui, and Yi Lu.
In this iteration, we narrowed the problem down to taking medicine for the elderly with chronic diseases. Because in more background research, we found that depending on the medicine, they can be a key to health or major health setback. When doses are skipped or too much medication is taken, the results can be deadly. Medication non-adherence is widespread among seniors. A meta-analysis of studies in a variety of disease fields, including diabetes and heart disease prevention, found that while complaint drug adherence was associated with lower mortality rates than patients with poor adherence. For the new problem space, we did a case study of an application called Pillboxy to understand the needs of elderly people when taking medicine. We found these useful points. And we also found some key points which are more acceptable design for senior.
The potential technology solution we proposed in previous stage was a mobile app for daily medical management for chronic diseases with a wearable device for patients. In the first iteration, the wearable device was a smartwatch which can detect the patient's conditions. However, from interviews with our stakeholders, we found that it was overcomplicated for the elderly to use. After researching the pain point of patients, we want to deliver a solution to match their mental model. For this milestone, we have narrowed the scope that the product can help with. The main function of the wearable device is reminding the patient to take medicine. They can set the dosage and time previously by the app. And we haven't decided the form of the wearable device for now. The alternatives of it would be a necklace, a bracelet, or a brooch. The form is flexible, so we hope it will be more attractive and acceptable for the stakeholders.
Our target user is elderly chronic disease patients, and our product is focusing on the problem of timely medicine taking. This time, apart from completing the influence of different stakeholders part, we create persona and storyboard to study more on user experience. After some research on the target user group, we use persona to more understand our users and their real situations. Then, we use the sample of the user group to create a storyboard to think about how the users may interact with the system and initially evaluate their experience stand by the user situations.
Two main risks we have identified are: first, there is a high chance that we are not able to conduct face-to-face evaluation through the target audience, which means the iteration of the prototype would be challenging. It is possible that the final concept might lose the essential demand of the users. The possible solution can be paying attention to the user comments through the existing products, also the feature of the high-rate products, and the prototype can be mailed to the participant's home. Secondly, at the middle and last period of the project, as we have designed several appearances of the prototype to investigate users' preference. The cost of making a prototype would be high, and it could be difficult to iterate different prototypes at the same time. The possible solution we have determined is to use a removable core interface to test the function, and put it into different frames to test the appearance.
The change of our project is supported by the data from academic papers and users' research. Except from reviewing the academic journals, we also conducted interviews, questionnaires, and probes. There are 4 participants that have been joined in the interview. The main theme of the interview is about the demand of reminding patients to take medicine and the appearance and the form of the prototype. And we plan to interview the last participants next week. The questionnaire is still at the stage of gathering data. The probe is also running. We are planning to finish all the data gathering by the end of the next week. In the meanwhile, we have designed several prototypes and conduct user research through the online meeting. We are now trying to simplify the appearance and make sure it is easy to use, convenient to carry, As we decided to let the patients control the alarm time by themselves, the interface of the application was also designed to more meet the elderly's demand. Thanks for watching, and we would appreciate any advice or comments.